Welcome to the Better You Project, where we will be discussing health, hormones, and aesthetics while using a blend of functional and anti-aging medicine. To make sure you're up to date on this and what's going on in the practice, be sure to follow us on Instagram at udirecthealth_aesthetics, as well as our website, www.udirecthealth.com. The following discussion is the opinion of nurse practitioner Lexi Yoo. It is not intended to diagnose or treat any conditions. Please speak to your healthcare provider for your personal concerns about your health. Now let's jump right into the show. What's up, everybody? This is Lexi from the Better You Project, optimizing health, hormones, and aesthetics. And today I have a special guest. I have Dr. Suzanne Turner. She is one of, I would say, like the most amazing people I've ever met in regards to hormones and education, and always a learner, but always a student as well. And so, Dr. Turner, do you want to introduce yourself as to, all that you do?
Sure. I am a physician in Atlanta. I have a practice with 4 amazing mid-level providers who are so smart and keep me on my toes every single day, sending me articles. And what do you think of this, Dr. Turner? It's really a great team. My patients keep me on my toes. We have patients who we do a lot of autoimmune disease, a lot of patients who have things like IBS, things like Lyme disease. So it's quite a cadre of patients. But then we have a good number of patients who see us for cellular and longevity health. So they're seeing us to try to maintain their health as long as they can and be the best self they can. So for weight loss also, of course. But then I have some athletes and some students who are just trying to peak their performance, to optimize their performance. So we partner with a lot of friends around here that are dietitians or that are trainers to work with everyone to get them to their optimal self.
Absolutely. So you and I met, we've actually seen each other twice now this year at 2 different conferences. In the most recent conference, I actually was hanging out with your husband, Chip. We were getting some water and tasting the wine. And I was just telling your husband that, your wife is amazing. If she ever needed a hype person, like I would be that person. And he's like, well, why don't you go talk to her? And I was like, I can't talk to her. She's Suzanne Turner. And he's like, just go talk to her. So since that time, she has been a tremendous resource. We do a lot of the same stuff. And so it's been awesome just collaborating different ideas, or like, hey, this is what I'm seeing, or this is what I'm trying. What are you trying? Or did you see this? Or are you going to this conference? So it's been awesome just collaborating with all the providers that we get to collaborate with, including pharmacists like Linda and things like that. So I want the folks to kind of, if you've never heard Dr. Turner speak, she's amazing, but I kind of want people to know how you got into peptide therapy.
Sure. So I had a hip injury years ago. I think this is now 10 years ago. I was running. I was a competitive runner for a while, just doing some races and such locally. And I injured my hip. I got what they call Trendelenburg, which is where your glute muscle just sort of stops responding. So you begin using your hamstring instead. And it was because I was wearing high heels all day long and then running on at nights and weekends. And most of my activity at the time was cardio. So I was doing a lot of that sort of activity. And because of this hip injury, I really had to completely stop running, which was very difficult on my psyche. Mm-hmm. So my husband at the time, he's been a lifter all his life. And so he said, you should start getting into weight training. So I met a trainer at the gym, started working out with her, did a lot of weight training with her. So I was probably late 30s, early 40s at the time. It was early 40s at the time. And so I continued doing that, more weight training, but it was still high intensity intervals. So we were doing 45 seconds of an exercise and a 15-second rest. And then that was an hour of a workout, and I would do that 3 or 4 days a week. And of course, the guy with the blower is coming right behind me. So
that's okay.
But we would do that 3 or 4 days a week. And then I started, because I was still having some hip issues, I went to a conference where I heard about mechanical growth factor. And it was so eye-opening, something completely different. All these patients, I don't know if you can hear me still.
No, I can hear you. No, you're good.
Oh, great. All these patients that I have so many injuries on, and someone said to me that I thought, okay, there's nothing else you can do. You can give them steroid shots. There's nothing else we can do. All these other patients that, I'd kind of reached the max of where I felt like I had things I could do that would be helpful. And all of a sudden there was this whole new category of things I could do and help people kind of move past and push past where they were, which was so exciting. So there was a conference that was Introduction to Peptides, a very basic, super, super simple conference that was going on in California. And I attended that conference and then came back to Atlanta just pumped up and sharing with my other providers in my office about what we were doing and how excited I was. So we did that, and we added a whole bunch of those peptides right off the bat. That was really fun.
What was that? What was that first peptide that you used then for your hip?
Mechana growth factor.
Oh, that's the name of the peptide?
Yes, MGF.
Oh, MGF. Okay. Yes. Okay.
Yeah.
I didn't even know that was the actual full name of it. Okay. Yes, MGF.
Yeah. It's a piece of IL-1. It's a slightly modified IGF-1, and it is involved in repair. Your body naturally makes it, is the first responder to repair, and when there's an injury. And so if you can give yourself an extra heavy dose of that, it sort of gets the repair mode restarted. And this was a chronic injury. So I did use that. I had a great result. I followed it with some IGF-1 LR3 and had a great result with that. Of course, my mechanics were part of the problem, and retraining my hip, that's just it's not a Band-Aid, but it's not a solution to the problem. Because if I had gone right back out and run, I would have injured the hip all over again and would have been back in the same position. So there was a lot of training that went along with that repair, retraining how I move and realizing that I have to engage glutes and have to engage lats. And so that was really helpful. And then we went to this conference, and then I went and did the peptide certification courses through one of the big companies that does those peptide certification courses. And as I was going through that, I really was fascinated by what I was learning, was really applying it every day this was a Monday morning. Peptides are a Monday morning fix people kind of thing. You come back and you go, oh my gosh, I have the best thing for you. You have to try this.
Oh yeah.
You make a list of people that you're like, I want to fix him on Monday and him on Tuesday. And my nurse calls them all and says, Dr. Turner's got something for you. And patients are used to that by now, because I'll come back from conferences and they'll hear a message from me like, hey, Dr. Turner has something.
Yeah. So I do that same thing through Instagram. And then people are like DMing like, hey, I need to get in there. Lexi was just at a conference. So we do the exact same thing for sure.
Yeah. We're just old school and we use phones and email. But that was great. And then because I started talking about it among people, there really weren't very many people doing it at the time. So I started talking to a few people about teaching, and then started teaching in the peptide certification program, which was really a blessing, because I love to teach. It's one of my favorite things. So I started teaching in the peptide certification. Thanks.
That's good.
It's really fun. I really love it.
So tying in, I kind of feel like when we talk about peptides, you have to talk about hormones, because I feel like a lot of the peptides are so interconnected into hormones. So, as we all age, unfortunately, our hormones start to deplete. A lot of them do, at least the good ones. And so I know you do a fair amount with that, but I'd like for you to kind of just talk a little bit about your experience, because you've been doing BHRT for a long time. And so maybe just kind of, if you could cover for some of the listeners, break down the hormones between estrogen, progesterone, testosterone, and kind of what their uses are as we look at certain things like body composition and energy and the symptoms that we see women come in with.
Right. So a good number of my patients now are in that 40 to 60 block, men and women in that 40 to 60 block. And we see them really struggle with that change. We'll see all of our hormones and most of our peptides will be depleted around the age of 35. This is why a lot of our athletes, you see those public figure athletes, they can't really compete much past 35. We have the rare exceptions, but the majority of athletes don't do much competing after 35. And so all of our peptides, all of our hormones, all of our repair capabilities, so our cellular repair capabilities begin to decline about age 35. You can certainly keep it up to some degree, but you're not going to be where you were when you were 25. And so a lot of people will go ahead and replace those. If we're talking about what do they do, a lot of the complaints I get from people is increasing weight around the middle, increasing fatigue, I hear people talk about low libido, and I would like to tease that out with people, both with men and women, but particularly with women, because I think libido is so multifaceted in women. And so I think about estrogen being the I feel sexy hormone and testosterone being the I feel horny hormone.
Mm-hmm.
And so they're kind of a little bit different, but you need both of them to get to achieve that, that libido, or what we consider interest in sex. Sure. Even sometimes with both of those in place, you have to remember there's so much else goes into libido. I always talk about, is your husband taking the trash out? Because if you're mad at him that he's not taking the trash out, how can you ever get to the point where you're able to do that? And there's a really great book, if you're interested in reading about it, called Come As You Are.
Oh, I have it.
I love it. I heard about it at the last conference that we attended. It was really great. And I read the whole book. It was so valuable, and it's really been useful for teaching patients.
For sure.
So thinking about estrogen and testosterone. So testosterone, I think about as, both of them I think about as your body composition hormones. So as you age, you're going to begin to decrease your production of estrogen number 2, or estradiol, if you're familiar with Latin. And then you're going to increase your production of estrogen number 1, or estrone. And the estrone has a tendency to wreak a little more havoc in the body. It's not 100%, but it does tend to wreak a little more havoc. So it tends to be the one that causes a little more weight gain around the waistline. It tends to be, and this is in men and women, and it tends to be associated with diet. So if you're taking in a lot of simple carbohydrates, but I think more relevant to that is taking in a lot of bad fats. So a lot of fried food, if you're taking in other than, so let's talk about healthy fats just briefly. I think healthy fats are things like nuts and seeds, olives, avocado, straight up butter. Because of the butyrate in butter. And so if you're using all of those things, you should be doing well. But if you're involved in any of the fats otherwise, like my favorite food, which is bacon, then you're going to really have it's going to be a hard time on your system. So that sends those bad fats begin to send signals to your body about how it handles insulin. And insulin is the carrier for sugar in your system. And so as those fats begin to signal your cells to do different things, they're not going to be able to manage your sugar as well. And so it's less about how much sugar you're taking in and more about how the cells are talking to each other about doing their job. And so those bad fats have a tendency to give the wrong signal about how cells should behave. So that's where we run into some trouble. So the estrone tends to be related to that, and we're removing the estradiol, which is that good, healthy memory, brain function. We know that there's an inflammatory process that goes on in all of our cells in response to infection or trauma or injury. And that inflammatory process involves the creation of, I like to call it a bomb inside your cells. That bomb requires 2 signals. One is the infection or the inflammation or the trauma. The second signal is lots of different things, but one of them can be estrogen deficiency, specifically estradiol deficiency. So you get the bomb in place, and then you add estrogen deficiency to that, and oh my gosh, we have a real problem, because now it's where we develop things like autoimmune disease, like lupus, rheumatoid arthritis, Hashimoto's, all of that comes from this creation. And so one of the reasons why we'll see a lot of, particularly women, go through menopause and begin to have more trouble about age 35 with autoimmune diseases is because estrogen deficiency is one of the triggers for that internal cellular bomb that we create in response to infection or cellular stress. So keeping your levels up to optimal is really one of the things we can do to stave off the onset of a lot of disease. And so there's a whole lot of things we have to do to monitor those. You want to make sure that you're staying in balance with your estrogen and progesterone. I like to talk about too much estrogen causes things like heavy menstrual cycles, breast enlargement or pain, irritability.
Dense breast tissue,
yes.
lots of that.
irritability,
Mm-hmm.
especially with brain, hand swelling. You'll see that sometimes. There's a whole lot of symptoms that go along with too much estrogen. Too little estrogen is where you see people begin to have things like depression. They'll have smaller breasts. They'll, of course, this inflammatory autoimmune processes begin to occur.
Joint
and
pain.
so, sorry?
The joints, their joints start to hurt.
Yes,
They lack
exactly.
lubrication, like eyes are dry, vagina's dry, their skin, like from an aesthetic person, I'm like, oh my God, I look at a face, I'm like, you need some estriol like on your face. Because they lose that plump, that rich moisture in their skin.
Yes, absolutely. Thank you. Lexi's introduced me to put my toe in the pool of aesthetics. So I've just begun doing a little bit at her encouragement, which has been fun.
Absolutely.
So yes, getting a little bit of your skin improved with some estrogen can really be helpful too. So the thing that's interesting about estrogen and progesterone is you can have plenty of estrogen, but if you have too much progesterone, you still are estrogen deficient. And you can have a lot of the symptoms of estrogen deficiency. Same in the opposite direction. If you have plenty of estrogen, but you have too little progesterone, you're still going to feel estrogen dominant. And you'll have a lot of those.
Do you feel like you see that more often where, like estrogen can look fairly okay, but then their progesterone's in the toilet? So I'm like, okay, it's not that you're over making your estrogen, it's just more you're under making your progesterone. And do you feel like you see that more often than the high progesterone, low estrogen ratio?
So I think it depends on the patient. I think if you're seeing a fairly healthy population, you're going to see that higher estrogen, lower progesterone, estrogen dominant symptoms. If you're seeing a less healthy population, you're going to see that same situation, but instead of the levels being down here, they're going to be up here. It's the same thing with too much estrogen, not enough progesterone, but it's really not a too much estrogen problem. It's really not enough progesterone problem.
Gotcha.
So,
okay.
And you can treat that in a couple of different ways. You can treat it either by raising their progesterone or by lowering their estrogen. And it kind of depends on where they are in that health spectrum and what their personal body is. So one of the questions we ask them is, how did you feel when you were in your second trimester of pregnancy? How did you feel when you were right before your menstrual cycle? How did you feel when you were on your menstrual cycle? Because right before your menstrual cycle is typically where we'll see that progesterone begin to diminish. And so that's a pretty good feeling. If people feel terrible, then we know, yeah, this is probably a progesterone drop, and we can give you a little bit more to balance things out. If you felt amazing like I did, as soon as I started my period, I felt amazing. And so that's, to me, estrogen and progesterone very low and testosterone a little bit higher. So a woman like me that has that history is going to feel a little bit better with a higher testosterone and a lower estrogen and progesterone. Even in menopause, she's going to feel better with a higher level.
That's interesting.
So this is where
explain like that. That's really three really good questions that I've never thought to ask. So I thank you. That's awesome.
Yeah. And if they felt amazing in the middle of their pregnancy, their second trimester, because everybody feels terrible in their first trimester, but second trimester, if you feel amazing, then you're probably a woman who really would like to have a lot of estrogen in your perimenopause, menopause life. You're probably going to feel that estrogen deficiency. Now I say that even the women who have very low estrogen generally are still going to feel that drop in estrogen. And sometimes they're going to feel it a little bit more because they're in a very narrow, their Goldilocks window is very narrow. So they'll feel uncomfortable when their estrogen is too high, but they'll also feel pretty uncomfortable when their estrogen is too low. And so you'll have a wider range in some patients, especially that second trimester I felt amazing person. They'll have a typically wider range of toleration, how they tolerate their estrogen, so they don't have to be quite so regimented on their dosing. Okay. So I started out completely using topical estrogens. That was my first education was in topical estrogens or topical hormones altogether. And then I've branched out as I've gone along and use all varieties of hormones. I really try not to use oral estrogen or testosterone unless I absolutely can find a reason to do it. I've used troches sometimes. Don't use testosterone in a troche.
Yeah, it's messy.
For your aesthetic concerned people, because it will cause a mustache to grow. Yep, hair coming out of their nose. They won't be very happy with you. Or acne on their face. But we use, I think I really like either the injectable or the pellet testosterone. And it really depends on the patient's lifestyle, what their circumstances are. Some people like the control of being able to adjust their dose. And some people like I don't even want to think about my hormones, just give me a pellet. And so it really is debatable. I tend to dose pretty low on testosterone pellets relative to what I hear other people doing, but I have very positive results from my patients. So I really like pellets. They seem to be and there's some great studies that have just come out showing that pellets show that really low breast cancer reduction, which is really great. So I have a few patients I've got a patient with BRCA mutation that we're just trying, because she feels terrible in menopause. So we're just trying her on some pellet testosterone to see how she responds.
Yeah.
The study was done with subcutaneous testosterone. And so that's what I'm using, testosterone in women, primarily subcutaneous also.
Yeah, that's good. And that's, if you're listening and you're interested in that research, there was a study that came out, it was like 3 months ago,
Right.
and that was with Mandy Cotton and Dr. Donovitz. And then there's even more research with Dr. Rebecca Glazier out of, I think she's, Glazier out of Ohio, I believe is where she's from. So, but yeah, lots and lots of research. And in fact, here locally, like in Indiana, which, I've kind of said I always feel like we're like the last people to catch on to anything, but there's actually, I did find a breast oncologist here locally who is open to having me treat her breast cancer patients with pellet therapy. So that's amazing, right? So that's good. It's good.
I think the interesting thing about that one, I think it was the Glazer study that showed it didn't matter if you use anastrozole or not.
Yeah. Yep.
Because there's been so much hype about if they had breast cancer, you have to use anastrozole.
Yep.
I love that she came out with that study saying you don't have to use anastrozole, because I don't want to use something I don't have to use, especially a small molecule. I'm not sure what it's doing. It's got so many negative potential side effects in men.
Absolutely. So yeah, no, it's fascinating stuff. Fascinating. So as far as the testosterone, we're talking about you did a great job covering estrogen, progesterone. The testosterone, when I explain it to women, I say, unfortunately, this is like the first hormone I usually see go away, unfortunately. And so when we talk about body composition, I feel like this is like the big one that I typically see help a lot of women. Unfortunately, it's not, especially in pellet format in the humid months, it's not the most friendly when it comes to the scale. Would you agree, Dr. Turner? About that? And the way I explain it to women is that, testosterone causes those nice muscle tissues to kind of start growing, and then they swell, especially when it's humid. So then they're going to hold on to water. So you might see a little bump in the scale for like maybe the first 4 to 6 months. And then usually like kind of the tail end of that first year on pellets, I really start to see body composition kind of take place. And we have an in-body, and I've told you that we have an in-body here on site. And so we try to make our patients get them all, they're free for all of our patients who are like, get an in-body, because then we can see what actually is going on. So, so yeah, absolutely. And so Dr. Turner did mention that she does testosterone injections with some of her females, which I thought was the first I'd ever heard about it, was like 2 months ago when we were just in Sonoma. And so, so that is definitely something that I just started incorporating with a couple of my patients. And so far it's been pretty positive feedback. So it's good. It's really good.
Yeah. You can do really low dosing. You can give them, and they respond with a good muscle mass response and typically a really good body fat % loss. So often you'll see, and again, this is with exercise, with, monitoring. You're not going to just, here's your testosterone, see you in a year. But most of them will make some big gains. I agree with you. A lot of times you'll see them gain weight, but I think it's really, at first you'll see sort of a plateau, and then you see them gain a little bit. It's typically around 5 pounds, but they're gaining muscle mass most of the time. So absolutely. That's what we want to maintain.
Yep, for sure. So now that we've kind of covered like the pathophys of all that stuff, which is excellent, let's talk about you a little bit in how you kind of said you were a little bit of a cardio bunny before, and then you kind of like changed it up, and then per our like Sunday evening me doing laundry conversation with you, you're like, well, this is what I really noticed. So can you kind of talk a little bit about how you transitioned from cardio into strength, and now I believe you kind of focus mostly on strength.
I do.
And salsa, right? You still
strength and salsa.
Chip, you're salsa
exactly.
dancing.
And
Okay.
I think because my salsa dancing is, we do it for about 3 hours a week.
Yeah.
And so for that, I think because that salsa dancing is kind of a low, I'm not getting my heart rate up very high. I am sweating a decent amount, but I'm not getting my heart rate up very high. And so I think I'm staying under that 70%, right around that 70%. And I think I'm staying in the fat burning zone.
Oh, for
So
sure.
I'm really able to maintain that fat burn. And I think that's really been helpful. So that's really the cardio I get. I walk with my dog on Saturdays for about 3 miles. But there's some really interesting research in the last couple of years that shows that really what I have done because my body demanded it of me is what we should be doing. That younger, we should be doing a lot more cardio, and older, we should be doing a lot more weight training. Because we naturally become sarcopenic as we age. And so maintaining that muscle mass, those muscle cells send signals out to the rest of the body saying, everything's fine. This is a young, healthy person. Everything's fine. And it helps with repair, helps with recovery, helps with all the things that you need. So we know that if you have a decent muscle mass, you're able to stave off aging longer. So that's what we want to do.
What do you always say? Muscle is the currency of aging. That's right. That was an Insta post like a week ago. It was good stuff.
Yep. My friend Carl says, go to the gym and make a deposit today.
That's right. That's right.
Yep. So,
kind of walk me through how your training is then now.
Right. So I switched over from doing that high intensity interval training because I think what was happening was I was really raising my cortisol. So we have to realize that any exercise is going to raise cortisol to some degree. But I was working out 3 or 4 days a week at 4:30 in the morning. And I think it was just over kicking my cortisol level. So I was starting my day with this super high cortisol. I have a fairly stressful job because I run this practice and see a lot of patients all day and teach and all that. And plus I'm trying to stay on top of all the research and stay ahead of all these people. And so making sure I can take care of patients. So I think it was just more than my body could handle. And I think what I was doing was decreasing my muscle mass and starting to retain. Because if you think about it, this is what I talk to patients about. If I'm telling my body that I'm being chased by a bear, then of course it's going to store up energy. It's doing what I'm telling it to do. It's saying, hey, store up energy so that you can either fight or run from that bear. And it was kind of doing what I was telling it to do. Yeah. So by switching up my activity level or my activity, what I was doing really, really, I think has helped. So now what I do is I go to a local barbell gym and I do powerlifting. And primarily what I do is heavy weights, low repetitions. Maybe I always stay under 15. Most of the time I'm under 12. 6 is my sweet spot for almost everything. So when I say I'm doing 6 repetitions, I'm really raising that weight level so that I'm feeling it at repetition number 6. And I'm working on my form and I'm focusing on doing that. And then I take some breaks in between. Whereas before I was taking maybe 15-second rest, I might take a 30-second to a minute rest in between sets now. Physically sit my high knee down on the table and rest till I catch my breath. And then it takes a short period of time for you to regain your glycogen stores. And so all I'm trying to do is regain glycogen stores in order to do another set. And then I rest, regain my glycogen stores, and do another set. Now, it takes about 48 hours for you to completely replace your glycogen stores, but you can, in whatever muscle group that you were working, but you can replace a part of them or a percentage of them in a very quick, short period of time with a little bit of rest. So that's one of the things I've started doing is I'm doing supersets. So I'll work chest and I'll do, 3 or 4 different exercises that work the same area, but in a slightly different manner. And then I'll move on to another group of muscles and we'll do that until I've exhausted that group of muscles, but with rest in between sets. Right. So I remember when I used to work out, I used to laugh at the guys in the gym, in the weight room, because I'd see them sitting around, playing on their phone, picking their fingernails. And I was like, what are you guys doing? You're not working out. Yeah. And now I see that they are. And there was a science behind what they're doing. Maybe not those guys, but
Yeah,
Anyway, there
maybe
is
not
a
that
science.
one, but I'm sure there was probably some. So
Exactly.
with that, like how many days a week do you try to hit like those big muscle groups? So like do you squat a certain number of days a week? Like is
I
there
try
like
to
a
do, yeah, I do
minimum?
3 days a week, and I try to do, I do squat and chest on one day. I do deadlift and back on another day, and
Perfect.
then I do a smattering of all of those on the third day.
So lots of push pull, right? Lots of push pull
Mm-hmm.
and recruiting those big muscle groups because that's a lot of where those androgen receptors are coming from. So,
Yes.
so 3 days of strength, a day of salsa, or 2 hours, 3 hours of
It's
salsa,
3 hours of salsa. Mm-hmm.
and then your walk with your dog for 3 miles.
Yep.
And then,
Mm-hmm.
is there a certain number of steps that you try to get in a day?
I don't. That's probably
I
where
was
I
like, are you
really,
like Dr. Earth and and oh, what is her name? They try to get their steps in like all the time. All the time.
Erica,
Erica,
Dr.
yes.
Schwartz.
Yeah, Dr. Schwartz. 10,000 steppers a day. I'm like, it's hard. Trying to get 10,000
It
steps a day
is.
is very hard, especially when you're like just going from room to room. You're really not walking far.
Yeah.
It is hard. It is hard. So, okay. I just want to make sure people understood that it's not like you're in and if you've never seen Dr. Turner, I'll post a picture of her. She's lean. Okay. She's jacked. She is super, super jacked, super lean. And I was like, whatever you're doing is like amazing. So I will post a picture so people can kind of see what you're talking about, but you're not spending, I mean, so how long is like a lifting session then for you?
An hour.
An hour. Okay. So you're not in
Yeah.
there 2 and 3 hours. You're lifting basically 3-4 days a week kind of thing for an hour.
Yeah. I lift 3 days a week, and then I salsa 3 hours a week.
Perfect. So, and
Mm-hmm.
she's felt, man, she's super. But okay, so which brings me on to my next topic. So we talked about your training. How do you recover now? Like, what is like? Are there like certain like rituals you have in your recovery? Like, how do you recover?
So I try to pause after my workout, because I'm trying to continue to tell my system that it's in, I'm not trying to build too much muscle.
Mm-hmm.
I'm trying to continue to tell my body, hey, I'm in recovery. I'm still in a need basis. So I'm trying to calm everything down so it doesn't, it doesn't flip over into that mTOR muscle building category right away. So I pause after my workout for about probably 45 minutes to an hour. So I'm pushing that window just a little bit more. And then I replenish with protein,
Okay.
protein carb, usually some ketones too.
Perfect. And then, so from a nutrition perspective, like, do you still fast? Like if you're working out that early in the morning?
So I work out in the afternoons now.
Oh, okay. Okay. And then, do you like, is there certain like, grams of protein you try to get, per day, or do you just try to go off feel, or like, is there anything that you track in that regard?
That's one of the better things about using a BIA, like the InBody that you guys use,
Mm-hmm.
is that you can tell what your lean body mass is.
Mm-hmm.
And that's approximately how many grams of protein you need to take in a day.
Right.
And so that's what I use, is 1 to 1.5 grams of protein per pound of lean body mass,
Mm-hmm.
or per kilo of lean body mass. And so I will increase that up to there. So I'm probably at 70, 80 grams of protein a day, which is pretty easy for me to meet.
Mm-hmm.
And then I'm doing, I try to stay pretty low in carbohydrates. Of course, my exercise does require that I do some carbohydrates. And so I love, and my microbiome needs my carbohydrates.
Yes.
So I do a lot of things. Yeah. So I use moringa. My favorite is that cocoa ringa, that hot chocolate. If you're familiar with it, it's delicious.
It's really good. Really, really good.
Mm-hmm. A little bit of protein and some from fiber.
So with that, do you try to keep your carbs under a certain minimum per day, or do you just really try to focus your carbs post workout? That's what usually I try to have patients, if your like goal is to like lean out and things, I try to get their carbs right after they work out, because that's when their bodies get right. They're going to be the most efficient in using them.
Absolutely. And a good workout before your Thanksgiving dinner is optimal. Yeah.
Yeah.
I'm not as good about, I still have a sweet tooth. And so I'm not as good about avoiding simple carbs like I should be.
Mm-hmm.
So just confessions, true
Yeah.
life confessions.
Yeah. Oh no, for sure. But have you ever had keto bark before? Keto bark?
No, is it good?
Oh, it's amazing. It's like it's made with cacao, so there's actually a good amount of fiber in there, and it's got like one net carb in there, and it's like keto friendly, so it's lower carb. It is amazing. It is so good. Like even my kids love it. Like, I'll say like they're like, "Can I have some, whatever?" And I'm like, "Okay, you can have this or this." They'll take the keto bark over like normal food. And what I like about it is though it's got like 7 grams of fiber in there, and so I'm like,
oh, that's awesome,
because of the cacao. So no, it's good stuff. But when I found my cocoa moringa, that's where I found the keto bark too. It's like, you may also like this. And I'm like, okay, well, let's try it. It's delicious. So that's helpful. Now, I know we'll be closing up here, but I just want to kind of go over just some of your favorite, and we've talked about this before, your favorite biohacking tool. So I know Esther's is like we talked about in Sonoma. I'm like, Suzanne, how do you get over the taste? You're like, you just do it. You just toss it back and do it. And like the worse it tastes, the better it is.
Hold your nose.
I'm like, oh my God. So talk about the ketone esters and how you use them, your nasal spray, oxytocin, and if there's anything else that I didn't mention.
I love that oxytocin nasal spray. There's so much great benefit. As far as your physical body, of course, that's something you have to get from your physician. Mm-hmm. But I've had some pretty good response in my patients using it for weight loss, because that weight loss dose is higher. You have to use it more frequently. Mm-hmm. Or if you're using it post-workout for muscle building. And so epicatechin plus oxytocin is kind of my magic combo for post-workout muscle building. And then I also love that beta-alanine SRT for preventing those, the DOMS, the delayed onset muscle soreness.
Right.
I think that works really well to keep you from having that sort of, oh, I can't work out today, I feel so sore. It really helps for that.
And then I think you also do butyrate, don't you? Isn't butyrate something? Or
yes.
We talked about butyrate.
So if you want to, instead of using the ketones, if you absolutely can't stand them, you can use, there's some great research on tributrin, Tributyrn, which is an ester backbone with 3 of the butyrate attached to it. And it's got some really good, there was just an article that came out yesterday on using tributrin and muscle recovery. So really great article. I'll shoot that over to you after this.
Yeah, that'd be awesome. Could we actually carry that one here in the office? Because we do so much with gut testing. We actually carry that.
I think it's a great option. And I think if the expense or the taste of the KE4 is not really helpful for the ketones, isn't really amenable to you, then I think it's a great option. And especially if you're not treating, if you're treating something like long COVID, or if you're treating something like SIRS, you really want to use a big power bang like the KE4. But if you're just treating day-to-day, trying to repair the gut, trying to do all those, I think that you're getting some good benefit from tributrin for sure. And that's a great recovery, because what you're doing is using it post-workout with your carbohydrates. You're helping your cells to recover. You're increasing the amount of antioxidant so that they can recover from that workout that you just had. So you want there to be a little bit of oxidation for a while to challenge the cells. And then you want to have an antioxidant on board to stop that challenge. And so that's why we use the ketones or the tributrin post workout. I love the oxytocin. It's got so much great benefit. And then the epicatechin as well. And I get articles every single day about the benefits of epicatechin. Love that stuff.
And is that one's a peptide, isn't it?
No, it's epicatechin is from green tea. It's a green tea extract.
Okay. Mm-hmm. Okay. And then I'm trying to think. I think that was pretty much it on the ones we've talked about in the past. So kind of I was sharing is that I talked to Dr. Turner about a month ago, and we talked. I kind of just said, I don't really need to lose weight, but I wanted to drop body fat percentages. And so one of the things that, I kind of changed some of the peptides that I was doing to help with that. And so one of the ones that I changed combo was instead of doing, and I don't know if you kind of seen or heard this too, it might've been on a podcast that I had heard it from, is CJC is great, right? CJC is awesome. But to really get the benefits of it, you kind of have to dose it frequently throughout the day, right? To really see the body composition. And kind of the way I heard someone explain it is that like tesamorelin, it's kind of like a little bit more of a potent peptide for body composition. It's nice is that because that one-time dosing kind of equates to what you would be doing like 4 times a day of CJC. And that's kind of how I heard it explained to me. So I was like, okay. So then when I talked to you about it, you're like, tesamorelin would be a good option. So I did tesamorelin with a little bit of semaglutide, but my semaglutide, I'm like a wuss. I get nauseous so easily. So I've only been on like 15 units of semaglutide, which is like nothing compared to what most people
Perfect.
have. I try to do the melanotan. I can't go above 5 units because I get nauseous. And then I started doing the once a week sirolimus. I started doing that on Sundays to kind of clean up the system. And then there was one more that you had mentioned that I'd started doing. What was it? Oh, the oxytocin, the nasal spray oxytocin. So I'd been doing that for 4 weeks, and I've dropped 3.6% body fat. I stopped doing any cardio. I don't do any cardio at all. Like, I try to get my steps in, but I don't salsa dance. I chase around my kids. So that's good. And then I hit all the muscle groups you were talking about. So I lift 4 days a week, and I do 2 on, 1 off, 2 on, and then 2 off. And just kind of everything kind of you said. So I try to hit somewhere around 90 to 100 grams of protein a day. And luckily, I have in bodies, but in that time, inflammation's gone down, A1C's gone down in just 4 weeks. Body fat's gone down, lean muscle mass has gone up. It's crazy. It's super crazy how quick you can see things. So, I kind of laugh, and maybe you get this too, but I'll get patients who are like, I'm doing these peptides and I'm not losing any weight. So then I ask them, like, are you lifting weights? Are you tracking your food? Are you recovering? All those things. Or they'll say, I got these pellets and I'm not losing any weight. And I'm like, you have to do all the other outside things. It's not just that's going to, make or break you. You have to do the lifestyle stuff, right? And so that's kind of why, I wanted Dr. Turner to get on here, is because I really wanted her to kind of show this is how she recovers. This is how she trains. This is how, what her protein tries to look like. And I think it's helpful, especially for females, because you see this in practice. Females get so discouraged because it's hard. It's really, really difficult as you age, and your hormones are just all over the place. And so I thought that this would be a really good podcast for a lot of our female listeners, because it kind of shows, that there are things that we can do to kind of help. And it's almost like hacking your hormone system is going to be the way to do it, and to train smart, to eat smart, and to recover smart. So, did I miss?
Don't forget about sleep.
Sleep. So recovery. So recovery. Yeah, exactly. Is there a certain amount of hours that you try to get a day?
Between 7 and 8.
Mm-hmm. Yeah. I usually try to shoot for 8. So when I get these females and they tell me they sleep 6 hours, I'm like, oh my God, that sounds terrible. That's like a nap. What's wrong with you? Perfect. Well, did I miss anything? Is there any other important keynotes that need to be mentioned, do you think?
No, I'm so proud of you. That's awesome. Good job.
Yeah. No, I appreciate all your help and guidance and all of that stuff. So, well, thanks so much for doing it. And I'm going to go ahead and just end it right there.